I want to share about my recent work investigating suicidality and its relationship with resilience in youth with a chronic pain syndrome called fibromyalgia syndrome. Suicide is a major problem for youth. This is especially true for the approximately 1 in 20 youth affected with fibromyalgia syndrome. These teens experience a number of physical and psychosocial issues related to their chronic pain, such as school absenteeism and anxiety and depression. While treatment of juvenile fibromyalgia includes psychological counseling, thoughts of suicide may be persistent in affected teens. Understanding how widespread suicidality is among youth with fibromyalgia, as well as the drivers for these persistent thoughts of suicide, can help us determine ways to reduce or even prevent suicidal thoughts for these teens. Specifically, resilience training interventions or resilience coaching may serve as a novel treatment to help reduce suicidal thoughts. Resilience can be defined as a dynamic process of positive adaptation or continued development in the context of adversity. An example of adversity could be living with chronic pain. Resilience is therefore a protective factor that may reduce the negative impacts of chronic pain. By examining resilience in pediatric chronic pain, we want to understand what allows some youth to adapt well in the face of chronic pain, and how can we harness that adaptive coping and teach it to other teens. Our research team has previously shown that greater resilience is associated with less pain and pain-related symptoms in youth with chronic musculoskeletal pain, but this has not been specifically looked at youth with fibromyalgia syndrome. Well, we already know that rates of anxiety and depression are high among youth with fibromyalgia syndrome, but we were alarmed to find that more than 25% of teens with fibromyalgia syndrome who see a pediatric rheumatologist reported persistent suicidal thoughts. Even more concerning, 90% of those teens with suicidal ideation were also receiving mental health services. This means that we must stay hypervigilant and not see a patient's participation in counseling services as a guarantee, because they may still have thoughts of suicide. Interestingly, we did find that those youth with higher levels of resilience were less likely to have persistent suicidality. This provides us hope that perhaps through resilience coaching, we can reduce or even prevent suicidal thoughts in youth with chronic pain. Currently, we are trying to do just that. Our team is conducting a feasibility acceptability study to see whether teens with chronic pain like and would participate in a resilience coaching intervention called Promoting Resilience in Stress Management, or PRISM. This intervention was developed by researchers at Seattle Children's Hospital for youth with chronic illness. PRISM consists of 5 one-on-one sessions with a resilience coach focusing on teaching skills designed to reduce stress, including mindfulness, goal setting, cognitive reframing, and benefit finding. If teens with chronic pain like PRISM and find it helpful, we hope to conduct a randomized controlled trial to see if improved resilience does indeed translate into decreased suicidality as well as other symptoms. We are hoping that by better understanding the role of resilience and resilience coaching in the treatment of pediatric chronic pain, we can provide new, helpful treatment options for youth living with chronic pain. Our team is currently working on 2 additional studies. For the first, we are interviewing teens with chronic pain to learn what coping mechanisms they identify as ways to be resilient. We're also going to launch a study to look at how resilience changes in kids with chronic pain and their parents over time. We hope this work will help the teens we see here at CHOP, as well as the teens cared for by pediatric providers all across the country.